my leg would just give out. It would just give out completely. I just couldn't walk.
A dull pain always. And then you'd have intermittent shots of severe, just excruciating pain.
I felt useless. You know, I was no longer productive, and I was a burden to everybody.
Over 80% of Americans will experience some sort of back or neck pain during their lifetimes. But thanks in part to new technologies and treatments found at the Southeastern Spine Institute, people all over the country are getting out of pain and back to their active lives.
Hi, I'm Vanessa Hill.
And I'm Angie Mazzell. Welcome to another edition of the Age of Spinal Medicine, presented by the Southeastern Spine Institute.
You know, over the years, people have asked, why is the Southeastern Spine called an institute? Well, in this episode, we'll do more than answer that question. We'll show you why.
That's right, Vanessa. We'll be sitting down for conversations with physicians, and we'll be talking to their patients. And you'll see firsthand how the latest technologies and procedures found here have helped so many suffering with debilitating back and neck pain.
And you'll meet many people, maybe people just like you, whose lives have been limited because of pain.
I did not know what it was to wake up in the morning without feeling pain. I thought it was normal that you just wake up aching.
I couldn't get out of the bed like I used to. I would have to kind of roll and bounce, roll over to the edge of the bed and bounce instead of just getting out like most normal people, and that wasn't good.
Where I went for several years in pain working and wondering if that was it. You know, I didn't have the same lifestyle I was accustomed to.
But because of the Southeastern Spine Institute, they are back to their active lives again.
The first thing I could do is I could immediately walk up and down steps normally. I haven't done that for 15 years.
It was like somebody had taken 100 pounds off my back.
And why are they feeling better? Because the physicians here specialize in spine ailments, and they're often helping people who could not find relief anywhere else.
There are lots of advantages, I think, going to a specialized place. First of all, you get multiple opinions. It's not like just seeing one doctor.
At Southeastern Spine Institute, we have doctors from multiple disciplines. We have anesthesiologists, we have neurologists, neurosurgeons, spinal surgeons. We have doctors from A to Z.
One of the great things about collaborating with other spine surgeons is that we're always there for each other. If someone needs a hand or if someone wants to bounce an idea off, someone's always there to lend their expertise.
And that unique combination allows us to give a proper diagnosis to patients. The diagnosis is very important. We can't fix it if we don't know what's wrong. The second thing you get is you get the latest medical treatment. So you're not getting something that was done somewhere else 10 years ago, and the combination of those two things are very powerful.
Because we have everything under one roof, at Southeastern Spine Institute, we think we can find a solution for your problem.
So stay tuned to learn all about the Southeastern Spine Institute and experience the many types of treatment options they have to offer their patients.
And you'll see why coming to an institute might help you or someone you know get out of pain and back to an active life again.
Always one step ahead, the Southeastern Spine Institute presents another edition of the Age of Spinal Medicine, a medical documentary hosted by Vanessa Hill and Angie Mazzell. This episode, why is it called an institute? Once again, Angie Mazzell.
We're here at the Southeastern Spine offices where we asked a number of patients what they think about when coming to a place called an institute.
To me, Spine Institute means that they would specialize just in spinal problems and they were the best around in spine issues.
Overall, they're just, they're state-of-the-art. They're up to date on the newest technology, and that's what you want if you're going to get your back fixed.
It's a place where they really know what they're doing. They have the best equipment, the best expertise.
And that expertise may help you solve your specific back or neck problem. We sat down with a patient with a unique perspective. We're here with patient William Goff, who, as an engineer, can really appreciate the technologies found here at the Southeastern Spine Institute.
The Institute, that's what it means to me. They are evaluating, exploring. There's new methodologies and technologies constantly being introduced into any market. By the same token, there's also that technology and methodology introduced in the healthcare field. They're also learning from their patient because no two patients are alike. What impressed me was when he told me it was specific to me.
But in the beginning, William did not really want to go see a doctor for his severe back pain, and I asked him why.
My wife was always pushing me to go to the doctor, but I guess stereotypical of males, last thing you want to do is go to a doctor. You don't want to appear weak or whatever.
But William finally listened to his wife, and he was glad he did. Many of the people we've talked to were so happy with the doctors they found here at the Southeastern Spine Institute. Vanessa, I understand you have William's physician on set.
Yes, Angie, I'm here with Dr. Donald Johnson, who started the Southeastern Spine Institute over 25 years ago. Now, Dr. Johnson, tell me, what did you do with William's back issues that made this institute different than other centers?
Well, we helped him with something that was very new at the time. He'd been to a couple different places. He interviewed a couple different doctors, and he kind of chose us. He decided that what we were doing is what he wanted.
I did my research, and when I discovered that Dr. Johnson had several patents, that they were innovative in their field.
We actually helped him by doing a new procedure, what we call a minimally invasive procedure. We unpinched his spinal cord. He travels around the country. He's a marketing manager. He's done very well.
I feel twice as good as great. I haven't felt this good I haven't felt this good in at least 25 years.
You talked about William traveling all the time. It has to be difficult to have his medical issue and he's sitting all of the time.
When you have a bad back, sitting is the worst position you can be in. Just ask anybody who's got a bad back about flying in planes or traveling in cars.
If you're flying 10 hours, the pain was absolutely unbelievable. Of course, some days were worse than others. But as soon as you were able to get up, you wanted to get up. And then you really didn't have a lot of relief. It was just trying to make the pain hurt in a different area.
The reason for that is when you're sitting, you take no weight off your body except through your spine. When you stand, you take weight through your ankles, through your knees, through your hips. But when you sit, where do we all sit? We sit on our tailbone, and our tailbone is at the bottom of the spine. So sitting's a bad position to be in if you have a bad spine.
But after William's exciting new surgery, he can sit anywhere he wants, and he doesn't even care if he flies first class.
Before I was hoping to get into first class because they don't say a whole lot to you if you get up and walk. Now, I don't care where I sit now. It's amazing.
You know, you hear about pinched nerves all of the time.
And William actually had a spinal cord that was impinged, a condition called spinal stenosis. Very common condition. Lots of different ways to take care of it. But at the Institute, we know what's the easiest way to do it.
And now, literally, I can do just about anything that I want to do.
What happens when back pain makes you feel like, well, it's not worth living anymore?
I didn't want a life of that. I'd rather leave than go through that and live my life like that. And I thought that's what I had in front of me.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. No referral is needed. And if you're enjoying the show, you can watch previous episodes from our medical series by going to southeasternspine.com and clicking Medical Documentaries. Once again, Vanessa Hill.
I'm sure that many of you out there can relate to our next story about a man who loved every part of being on the water. In fact, he earned a living as a tugboat captain and a full-time mariner.
I consider myself a maritime athlete, honestly, industrial, because it's been quite an adventure. Let's face it, the maritime industry is one of the most dangerous in the world because you can't have any mistakes. And the captain is always responsible. So you didn't leave it up to anybody else to make sure it was right. So you did as much work as the crew.
But one day, when Captain Barry was making a simple jump from a dock to his tugboat, something happened that he never could have foreseen.
So I took my jump and I landed really well, solid. And my back said it was a little bit too solid, and pain just went right up my back.
And that pain would change his life as he knew it.
My life crumbled. And I have a hard time talking about it, because it was that bad. Every day was spent in pain. I felt useless. You know, I was no longer productive, and I was a burden to everybody.
In desperation and no longer able to live the life that he knew and loved, Barry decided to have back surgery in Charlotte, North Carolina.
And I had 2 unsuccessful back operations. I tried to go back to the boat, and I lasted all of 3 weeks total on both times before I was off the boat again and getting another operation, and to where I was in total hopeless and despair.
Just when it seemed like Barry had reached the end of his line, he finally found the Southeastern Spine Institute and Dr. Donald Johnson.
When I was introduced to Dr. Johnson, that was a changing point in my life right there. Dr. Johnson spent more time with me on my first visit than my other doctor did in 2 years. And I knew when I left his office, I had a new doctor. And I had hope.
Dr. Johnson, could you tell us how you were able to help Barry after he lived with debilitating pain and couldn't find relief anywhere else?
When a disc slips out of place or herniates, what the doctor does is remove part of that disc. And in Barry's case, that had already happened twice. Once you remove part of it, it's weak. And so if you injure your back, that's the disc that gets re-injured. So he herniated or slipped this disc a 3rd time, this time against his spinal cord. And rather than saying, look, we're going to trim it again, and then in the future again and again and again, he came to the Institute, and we have technology here. We were able to remove the whole disc, but we replaced that disc with something that gave him 2 things. 1, he's never going to have to worry about another surgery there. And 2, he's able to get back to life.
And so he gave me mobility back and plus some. You know, a quality of life that I never expected to have again. And those things have come true for me.
Well, there is a happy ending. After years of living in pain and no hope, Captain Barry's modern surgery got him out of pain and back to a life of retirement and some calm reflection.
Learned to pace myself and float around and do a little bit of calm sailing. A fair weather sailor now. All the wonderful things that I grew up with here in South Carolina, and having that rough mud in my toes, and having a little bit of salt water run through my veins, the mud in my teeth from throwing the cast net. I want to teach those things to my grandchildren and get those to understand and experience the gifts that I've had by living here in South Carolina. Yeah, I'm glad I stuck around.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. No referral is needed. And if you're enjoying the show, you can watch previous episodes from our medical series by going to southeasternspine.com and clicking Medical Documentaries. Once again, Vanessa Hill.
Welcome back. I'm here with Dr. Thomas Anderson. He is a neurosurgeon with the Southeastern Spine Institute, and he tells us about a patient by the name of Charlene.
Well, Charlene came to us with some severe pain in her left arm with numbness.
Pain is down the left side of my neck, and I'm also experiencing tingling and numbness going down the left arm.
Does the numbness and tingling go all the way into your hand or your fingers?
Yes, all the way down to the tip of my fingers.
They start at the beginning and they take the baby steps and work forward. Find out what is your problem. This is what we can do for you.
We evaluated her. She had an MRI scan of the neck, and we determined and pinpointed the cause of the pain. Turns out it was caused by a pinched nerve in her neck from a disc problem.
There's the nerve root coming out at this level, and there's the one here, and it's pretty badly compressed.
And prescribed some treatment for her that was non-surgical to see if we could improve her situation.
What the Southeastern Spine Institute was able to do for Charlene was an epidural block to quiet the nerve and help her get back to full motion. This non-surgical treatment works so well for many and often is all that is required to get back to an active life without ever needing surgery.
Never need any surgery, and don't look to have any surgery. Just as simple and trouble-free as it could possibly be, and the relief and the change and the quality of my life. Listen, if it would have been 10 times the trouble, If I would have had to walk from here to Florence, you know, it would have been worth it.
While the shot did help Charlene for a while, unfortunately, the pain did come back.
And then by that time I decided, well, the shot didn't work, so why put it off?
And she decided to take care of the problem once and for all using new technologies and advanced surgery techniques found here at the Institute.
One of the things we strive to do is be minimally invasive with our surgeries. And some of the ways in which we do that is using very, very small incisions to do our surgeries, as well as exciting technologies like the operating microscope, which can magnify the size of our surgical field dramatically and allow us to be very, very precise.
So what was the outcome of Charlene's advanced surgery?
I'm doing great. I appreciate everything you did, and everybody I know you're gonna go see.
It's amazing to live through pain and then not to have that pain anymore.
Yes, I think so, and I think a lot of times we lose track of that, but as physicians, because we're so focused on the technical aspects of what we do.
After surgery, it was like angel sang. I'm not kidding, I wanted to get up and just leave. It was perfect.
When I came here expecting great things, and when I got here, I got just what I was expecting.
Dr. Johnson talked about several different specialties when talking about the care that is provided here. How does neurosurgery come into play with that?
Patients with spinal problems are often concerned about the health of their nerves, and I use my training as a neurosurgeon to help protect those structures, whether we do surgery or whether we don't.
When we come back, you're going to meet a man who had a passion for helping others until his back pain became so much of a problem, he could barely help himself.
And it took away some of the main things in my life. And it was really sad, really sad.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. No referral is needed. And if you're enjoying the show, you can watch previous episodes from our medical series by going to southeasternspine.com and clicking Medical Documentaries. Once again, Angie Mazzell.
We're here at the Ronald McDonald House in Charleston, a home away from home for families with critically ill children. When Chairman Bert Hefke wasn't able to do the work here that he's so passionate about because of his own medical problem, he called the Southeastern Spine Institute.
They're on top of the latest developments in spine care. They have the ability to diagnose whatever is wrong, and most importantly, they have the wherewithal to fix it.
But could the Southeastern Spine Institute fix Bert's problem? And could they help him get back to his charitable work at the Ronald McDonald House? Well, it started with getting an accurate diagnosis.
My diagnosis was acute stenosis, and it was incredibly painful.
So tell me a little bit more about that diagnosis and what that actually meant.
I had compression on the nerves, and that's what was causing the pain, and just a debilitating part of the condition. I really didn't want to talk to people. I didn't want to see anybody. It was depressing.
Fortunately for Bert, there was new technology waiting for him at the Southeastern Spine Institute. A new device for stenosis that is an alternative to major fusion surgery.
It has the effect of taking the pressure off the area that's causing the most pain and relieving some of the stenosis. I'm able to do most of the things that I was able to do prior to having the back pain.
Now that you've heard Bert's story, Vanessa has more from Bert's doctor.
Yes, Angie. And Dr. Stephen Paletti joining us now to talk about this revolutionary procedure. This is new. This is big.
Yes, Vanessa. This procedure is called a Coflex implant, and it's something that we put in patients who have spinal stenosis. Now, spinal stenosis is narrowing of the room for the nerves of the spine, and it's primarily caused from arthritis. When you get arthritis in your hands, your knuckles enlarge. When you get arthritis in your spine, the joints that move your spine enlarge, and when they enlarge, it can pinch against the nerves. Many people with spinal stenosis always have to grab the grocery cart because leaning forward opens up their spine, gives the nerves more room.
Explain to me, if you will, how this was able to help Bert.
In a case like Bert's, we're able to take this small titanium device, and this is the actual size.
That's all it is?
That's all it is.
Wow.
And this can actually snap or wedge in between the two bones and hold them apart. It separates the vertebra so that they no longer have pinching of the nerves. We've seen hundreds of people that have had this revolutionary procedure done and been able to avoid a much larger operation.
And I'm really grateful that a procedure like this is able to help not only myself, but hopefully other people.
I think that there is newer technology being developed every day. We try to stay on the forefront of that so we can offer our patients what we consider to be the latest technology. So if you have a problem, if you've been told that there's nothing that can be done, there are things that we can do today that we couldn't do yesterday.
This place here, they have grown quite a bit. Okay, there used to be about 3 doctors. Right now there's a lot more, and perhaps that's a test to their success and their ability to help people.
For somebody like Bert, it's allowed him to get back into the activities that he likes to do, because if he wasn't there doing them, there would be some big shoes to fill.
I've been able to be active and renew my golf, my family activities, everything's basically gone back to normal.
Timing was right. It's a good feeling to be able to participate in the latest technology and have that actually make a difference in somebody's life.
When we come back, we're going to find out why sometimes the most effective treatment for your back or neck pain may really not be that new at all.
Sometimes you don't need to go through surgery, and hopefully that's the case. You know, the last thing should be surgery, and I think they're very conscious about that.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. No referral is needed. And if you're enjoying the show, you can watch previous episodes from our medical series by going to southeasternspine.com and clicking Medical Documentaries. Once again, Angie Mazel.
You know, even with all of the latest surgical procedures and techniques, we found here at the Southeastern Spine Institute, there's one thing that still works best for more than 90% of their patients, and that's no surgery at all. Most often, and for most patients, simple lifestyle changes coupled with the correct exercises, medications, and non-surgical procedures can get you out of pain and back into your active life. We sat down with Southeastern Spine's physical therapist, Melissa Langston, to find out all the many ways they can help patients avoid surgery.
If they have tightness in that area, we'll work on stretching, or we do a lot of manual techniques, joint mobilizations, dry needling, myofascial massage. We also can use kinesiotaping to help correct postural misalignment and help facilitate certain muscles. And then you definitely need to go over body mechanics. If they have something where arching their back can make them worse, then you want to educate them that yes, they can go to their Pilates and they can do their yoga, but maybe watch these certain positions. Over 90% of the patients that come to Southeastern Spine Institute do not need surgery. Coupled with physical therapy and the treatment from the non-operative physicians, we're able to get the patients back to their normal activities.
Very happy today, and finding out that I don't need surgery, it looks like, that there are some therapies and things that I can do to make this better without going through all of that, and that's a relief. And that's the one thing I heard from other people was, you know, they're not going to go down there and force a surgery on you.
He was going to try the less invasive approaches first and see if it worked, and thank God it has worked.
Did you know that the majority of the physicians here at the Southeastern Spine Institute are non-operative doctors? And Vanessa, you have a couple of them with you on the set.
Certainly do, Angie. I'm here with Drs. Gehrman Levin and Dr. Ricky Richardson. What's it like handling the non-surgical aspect?
Well, our job is basically to try to keep the patients from needing to see one of our surgeons. We like to see patients as early as possible because if you do have back issues, the earlier that that patient is seen, the greater the likelihood that they won't need to come back to see us down the line.
So then there's a point there. Get in as early as possible.
Yes.
I would suggest absolutely for patients with acute pain, get evaluated and treated as early as possible. But also for patients with a chronic pain, there is always some options available to improve pain. And what we hear the most when patients come into our office, they say, I have arthritis and there is nothing you can do, and it's not true because you cannot cure arthritis, but you can help with the pain from arthritis.
And also to try to keep that patient from becoming worse, or from an acute problem becoming a chronic problem. So the earlier they come in to see us, the better.
How is the recovery with that? So many patients, as Angie just told us, really don't need surgery.
Yes, well, that is true. Oftentimes, when patients come in, they're worried that they're going to need surgery, and that's the only option for them. But oftentimes, that's not the case.
I'll be riding with you. Thank you.
Had several local appointments and didn't feel like we were having any progress. So we came here and we feel that we're on the right track now.
I don't want any pills. I don't want anything to just mask the pain that I'm having. I want something to make me better. And he shook my hand and said, well, I think maybe we can find something.
There's physical therapy. If a patient is too painful to participate in physical therapy, there are other options as well, such as injections, and that's a big part of what we do. Something called an epidural steroid injection, and that is a way to get the steroid medicine to shrink down the swelling or inflammation that they may have right where they need it, and to help them recover as quickly as possible. We're able to walk them through a process where we can avoid surgery altogether.
Well, that's our show. We hope you've learned a lot about the new medical technologies at the Southeastern Spine Institute from the medical doctors and their patients.
And now you can see why they call it an institute, because they help so many people in so many different ways.
And as always, we leave you with the thoughts of real patients who are so happy that they found the Southeastern Spine Institute.
And be sure to join us next time, and just maybe we'll tell your story.
Bye-bye.
The testimony of my life and what I can do now is enough for anybody to consider going.
I decided to make my own referral. Yeah, I didn't have time to wait for somebody to, hey, I'll call for you. I said, I'm gonna call for myself because I can do that.
It's the highest of quality that I'm aware of, and that they specifically focus on the spine, which is my issue, neck and back.
Jack, you cannot compare it with any place around here. It's wonderful.
It's been like a miracle cure for me. I mean, it has turned my life around.
It's just a great place to get your back worked on, your spinal worked on, and I just would recommend it to anybody.
Everybody's just so friendly and so helpful. It's like they care. I mean, they care about their patients.
We hope you enjoy the show. You can watch any of our Age of Spinal Medicine episodes by going to southeasternspine.com and clicking Medical Documentaries. And if you're interested in seeing if the Southeastern Spine Institute can help you or someone you know, please call 866-SPINE50 to make your own appointment.